بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين. Inshallah, in this video we're going to talk about how to fill an antenatal clinical sheets. It's pretty straightforward and pretty easy. As you can see here is the previous sheets. It started with the student email and group and date, and we're going to explain some of the terms a little bit in detail since you are pretty new to this area, just started taking the maternity course. The person data is pretty, mother initials. We don't write the patient's name. We don't write the MRN number, education, date of admission, and the general information. And the reason of admission and the chief complaint is important, and date of admission, and the gestational age. GA stands for gestational age, or antenatal weeks, how many weeks she is so far in her pregnancy. Moving down to medical and surgical history, we're giving you here some examples you can ask the mother about, as you were told in fundamental nursing the previous year. Diabetes mellitus, gestation and diabetes mellitus, heart disease, hypertension, anemia, kidney disease, and so on. And we're giving you here an options of others if there is other medical condition the patient is complaining from or she has as part of her medical history. Surgical history, here we're going to talk about minor and major surgical procedures, and it can be mentioned here. As you can see in this box, and you can write here, story fine. Family history, either paternal or maternal history. We just listed diabetes mellitus and hypertension because it's the most common comorbidities in Saudi Arabia. However, there are other conditions like COPD, asthma, other GI symptoms, cases, and they might mention. That's why we have the other options over here to write whatever the maternal or paternal or maternal history they have, either from the mother's side or the father's side. And then moving down to obstetric history, I think if you watch the labor and delivery sheet, it's the same, the typical table, number of gestations, number of gravida, and should be also number of para, the sex of the baby she had, boy or girl, age at birth 22 weeks, 37 weeks, 40 weeks, whatsoever should be written here, the weight of the baby, and type of delivery, if it were like SPD or cesarean section or assisted delivery, and any complication it can mention here. Complication is so important, just to keep an eye on that patient. For example, I will give you an example. If the mother has a postpartum hemorrhage in her previous pregnancy, she might also develop postpartum hemorrhage, similar for preeclampsia, the same. So it's just help us to keep an eye on the patient with her current pregnancy. And remember that antenatal clinical sheet, antenatal means before delivery or pregnancy. And in some hospital they might call this floor or unit or ward, they might call it high risk pregnancy unit or floor. It's the same, just because women they are admitted to the antenatal ward if they have complication, and sometimes this complication categorize the pregnancy as high risk pregnancy. And also we are in the previous obstetric complication here, we added here as well just for more emphasis. If she has an antepartum hemorrhage, preeclampsia, eclampsia, polyhydramnios, excessive amniotic fluid around the baby, and also we just listed a few just to give you an example, but if there is others, definitely you have to list it down here. And previous intrapartum, postpartum abnormalities, it's similar to the data over here, but it's just more details, like what is cesarean section, was it assisted delivery, did they use ventos or forceps, and again intrapartum means during labor and delivery, postpartum mean after delivery. Okay, if she has prolonged labor, we're gonna talk about this in detail in the lecture, and also we're going to talk about it when we talk about partograph during the lab, postpartum infection, neonatal jaundice, and postpartum hemorrhage. If you notice that we have complication related to the baby and related to the mother, and definitely if there is others, it should be listed. For the present pregnancy, we're going to start with the LMB, last menstrual period. It's pretty important to help us to identify the expected date of delivery, and also to help us to calculate the gestational age. And every visit the mother is visiting the obstetric clinic for a follow-up. So we're going to talk about this. When do we consider it, and when we don't, and what more details. But for now, the LMB, the first day of last menstrual period, you will ask the patient, you will record it here, and according to the LMB, you will calculate based on Niggles rule. You will calculate the expected date of delivery, EDD. So the medication sheet, and there will be always a medication sheet for the cases in antenatal clinic. Basically, you're going to list the medications that your patient is currently taking, whether that would be antibiotic or low molecular hemoglobin, sub-Q injection, antenatal vitamins, ferrous sulfate, so on. Cytotic for patient induction, for labor induction, and whatever the type of the medication is taken, you have to list the name of the medication, the category, the action, the mechanism of action, and the route and the frequency and the dose, and etc. For the medication she was receiving at that time, then side effect and nursing intervention, and they are all available on the medication sheet. And the medication sheet, if the medication sheet is not available in Blackboard, please ask your clinical instructor or professor to do so. The chief complaint for the current pregnancy, and it could be vomiting or dizziness. Here we're talking about excessive vomitings, a case that we can call it hyperemesis gravidium. We're going to talk about in the lecture if she is having headache, excessive vaginal discharge, backache, blurred vision, bleeding after 20 weeks, preeclampsia, and abdominal pain, varicose vein, bleeding, edema, especially the lower extremity edemas and the upper extremity and the head, upper extremity edema, especially on the hand and the face. We also monitor that. It's one of the implicit signs during pregnancy, and if they come with other signs, it would be like another would be diagnosis for more complicated pregnancy. That's why we monitor the mothers for it. And eclampsia and preeclampsia we're going to talk about in detail in the lecture. Definitely there is other chief complaint, more serious complaint, that the mother might be admitted to the hospital because of this complaints, such as premature rupture of membrane, decreased speed of movement, intrauterine growth restriction, and so on. The list will just go on. Laboratory investigations, and we just mentioned here a few of many: hemoglobin, hematocrit, platelet, toxoplasmosis, hepatitis B virus, and there are other blood work. It can be mentioned in separate page if you want, and important as well. Urine analysis, glucose, abdomen, acetone, just regular urine analysis that we studied when you was taking your foundation course. Tetanus vaccine is also one of the vaccine that we asked the mother if she received it and when she received it. Was it 5 years ago or 2 years ago? Does she need a dose? How many doses she has received? Also, we should ask about flu vaccine as well. It's not listed here. For the genetic examination, definitely vital signs, general temperature, pulse, respiratory, then appearance, basic physical examination, and we also focus in the breast. We do assess the nipples, if it's flat, if it's normal, if it's inverted, because sometimes we need to do extra education to prepare the woman for breastfeeding during postpartum. Any changing in the face, we're going to talk about it in the eye, neck, and head. We're going to talk about the physiological changes that you might expect it in pregnant women during pregnancy. Yeah, definitely. Heart and lung sound. What are the expected heart sounds that we might hear in the third trimester? The abdomen is for pigmentation, extremities, bowel function. We're gonna know most of them when they have constipation, we know why, urinary frequency, and all that, and psychological condition for sure. So for the local abdominal examination, there is a lab for that. We mean by that Leapoy's maneuver. We're going to teach you how to assess for the level of the fundus to identify the gestational age. You're going to record it here definitely, and the lie of the baby, longitudinal transfer or plague, and the presentation, for example, is it cephalic or breech. Then, and also we're going to teach you how to record the fetal heart rate using Doppler machine. So, and this is a lab by itself. There's a lot of details are going over here, but inshallah we'll cover it in the lab. And we always try our best that the student, they don't start their clinical practice before covering all this basic lab, which is important for the clinical practice. The nursing care plan, the last part of the clinical sheet of antenatal unit. And in the nursing care plan, please consult your clinical instructor, consult your professor. How many actual nursing diagnoses do they want? Do they request? How many potential nursing diagnoses? Some professor, most of them, they use rubric when they correct nursing care plan. Make sure you have to check this rubric to understand how the professor, they're going to correct the nursing care plan, and in which criteria, in which rubric. And if the rubric is not available, please ask your instructor to make it available on Blackboard.